Hello, and I hope you're all doing well. It's a pleasure to meet you. My name is Ben Abo, and I am a Touro University, California alumni from class of 2011, and actually the creator of Benny the Bull. That's why the bull's supposed to have some curly hair. But I'm happy to talk to you today at the online Solano County Virtual Fair. And want to tell you a little bit about one of my passions. It's about really getting anybody outdoors. And we're going to talk a little bit about safety dealing with snakes and venom. And interestingly enough, I actually used to have a huge phobia of snakes until even after a little bit after I graduated from Touro University. This one that I'm holding here, no, is not venomous. But then again, the one that I'm holding here and handling here is while working in a clinic that I started with some others trying to take care of people in Guinea, Africa, and that's a forest cobra. Since my days at Touro, I have gone from dealing with general medical emergencies and emergency medicine, and now I'm actually a toxinology and venom specialist, as well as EMS and fire rescue. Do I expect a lot of people to have as much experience or comfort as I do? No, but I want you to be able to be safe and not worry as much and know how to handle yourself in terms of an emergency if you're going to be out there, because there are plenty of snakes out there. If my pictures do look familiar to you of me, I have been medical director of Shark Week, getting some of my books out there, but also more recently I am on TV show called Kings of Pain on the History Channel. And basically we dealt with a lot of things with these two guys getting bit and stung on purpose. Of course, this snake that we're about to unleash here is a 16-foot reticulated python. It's not venomous, and this is all the way over in Bali. But let's talk about California. Let's talk about the U.S. a bit. Overall, there's a lot of snake bite kits and different things out there. How do you be prepared? Do you need to kill them? No. Overall, the only true cure for an envenomation is anti-venom. Period. End of story. The snake is not trying to hunt you. The snake is not trying to kill you. It's just trying to protect himself. And the venom is actually used for its food. But you happen to startle it. So there's a lot of myths. Oh, this snake is going to chase you, something like that. Not one snake in the United States is going to do that. They don't want to have to use their venom if they don't have to. Usually it's when you're walking and they're over a crevice, or you put your hand somewhere into certain bushes, things like that, where they're trying to hide, and they either think it's a mouse coming around the corner or that you're threatening it. So we mostly have to deal with rattlesnakes and pit vipers overall. And pit vipers include copperheads and water moccasins also that don't have rattles to warn you. They do have teeth that retract and come out like this in the fangs. And they can blend pretty well into kind of different environments. Here you can see the anatomy of the rattlesnake, and actually its head's pretty pliable there. And some of them can get pretty darn big. Now, the venoms that are in these snakes do a number of different things. And like I said a minute ago, where the snake uses its venom to hunt, that's honestly what it's for. If it has to use some on you, it will. Here in this picture, an eastern diamondback. In this next video here, you can see in slow motion an eastern diamondback being milked, so to speak, for its venom. Now, it will use these needles and these teeth to inject a lot of toxic venom, but they don't want to have to use it on you. And the fact of the matter is that, yes, the venom will do damage to you, but we can fight this if you do the right thing. Look at how much is coming out because it's in its feeding response. And of course, look at the cute kids that are watching in the background.
Need a hook? Need a hook?
So we're pretty lucky in the United States where we don't really have many deaths. In fact, I can count on one hand the number of deaths per year from snake bites of indigenous snakes. Elsewhere in the world, that's a different story. That places people aren't as lucky. But what we're trying to fight with anti-venom care and venom care is permanent pain, permanent disability, and permanent disfigurement. So first off, of course, if you can prevent the bite from happening, then great. Otherwise, there's care and different things that we need to do. Now, a lot of people are going to ask me, what's the difference between venom and venin, or anti-venom and anti-venin? Really, it just depends if you have a British background or American background. Either way, it's fine. You just don't hyphenate the word. You can see here some of the markings tell what we're going to do with the skin wounds and the changes. In fact, in the bottom right is my friend's aunt who was bit on the foot by a copperhead. And we needed to elevate her foot, which is different than what you may have been taught. And that's okay, because that's why I'm here to help you dispel those myths or know who to call. You know what? Like I said, I want to prevent some of this permanent pain, permanent disability, because once the venom does damage, it can't reverse it. We can only stop the progression. Now, we can fix things where this is a gentleman that was super sick from a rattlesnake that has a lot of neurotoxins also, just like the Mojave out in California. But with the right treatment, where you barely even see a wound, he's good as gold, right? So some snakes will cause skin and local effects, but others can cause very systemic effects and can be scary. And you need to take snake bites seriously. There are people that say, oh, well, it's only a little venom, this and that. You need to see an expert and get to help. Call me anytime, call Poison Control, because untreated, it definitely can lead to some serious permanent issues. But we can save you and take care of you and reverse even major effects. Even this kid who wanted to kiss his pet snake, that was a wild one that he kept literally under his bed in a pillowcase, inappropriately, and he was bit on the face. This kid's still doing fine. And here's my buddy Garrett, who's a kid that was bit accidentally by picking up a coral snake, and he was super sick. But I fought to get him the right treatment, and he's doing great now, and we keep in close touch. First off, what do you do for an envenomation? First off, you want to prevent it. If somebody else is bit, I don't need you to catch the snake. I don't need you to kill it. I don't need you to bring it in, right? If you can prevent, don't walk in a brush that's too high. If you do, you should be wearing pants. You should be wearing boots, maybe leg protection, especially in certain parts of the desert or in the mountains, because you might just come across them, so that they, snake wranglers will wear kind of like shin guards, and those I have also if I'm doing some kind of rescue in snake type places. I don't need you to bring it in for identification, because I have one cure for all of them in North America, and so I don't really need to know. And you can take a picture. I mean, we're even doing this as a Zoom conference right now. We're pre-recorded. So someone's going to say, well, here it is, so you can identify it. Don't worry, I killed it. Well, guess what? A lot of things look similar. I'm only treating by symptoms, and they look and think that they're in trouble. But even if the snake is dead, it can still envenomate you. This is a copperhead in Texas in a hospital Ziploc bag that they thought was dead and started moving. What if someone got bit by that in the ER or while transporting it? And the fact of the matter is, I don't need you to deal with it. I don't need you to bring it. Just take a picture or just get the person to care. Now, do's and don'ts. This is the crux of what I want you to take away. Don't buy these snake bite kits. Don't cut and suck it out. I want you to, as quickly as you can, let's say I get bit. Benny the bull at Touro gets bit hiking around Solano County, right? I want you to mobilize it, keep it still, and remove any jewelry. I don't care which hand got bit or if it's their foot. Take off all jewelry so that it doesn't swell. If you can, keep it higher and elevate it like your foot or your hand has a question, or at least at the level of the heart. And once you get to the hospital, then we'll elevate it like the picture they showed you. Call a venom or tox specialist. Not many emergency physicians have treated snake bites. And you can call me over in Venom 1. I treat snake bites all over the country and the world. But most poison controls do a pretty good job in calling this particular specialist and get somebody involved to help guide the care. I'd like you to mark the leading edge if there's either swelling, discoloration, or tenderness or pain. I want you to mark that the line, that measuring the circumference around, the size around, that doesn't matter as much. But just mark the leading edge so I can see you at the time as it's creeping up. Give some pain meds. We prefer no Motrin or ibuprofen or Advil. Get some Tylenol, get some good pain medicines on board. And this is another reason why it's beneficial to call 911 and go by ambulance, because you can start getting pain medicine. And of course, leave the snake alone. Leave it alive. Leave it away from anyone. It will go away. This is an example of how I like to mark it. You can see the S for swelling, P for pain. And I look down their arm and I kind of poke. And I'm like, oh, it hurts up here when I press, so it's tender. I put a line and then I repeat it after that. Once you come to the hospital, other than deciding blood work and giving you antivenom or not, I'm going to elevate it. You need to make sure that you ask that it's elevated, because people don't get this yet. I don't say this like a pillow or two, like you sprained your ankle. I want you to elevate it up high and we can still see your hand or your foot, right? What I don't want you to do ever is shock it. No car batteries, no tasing it. You do not put on a tourniquet to prevent the venom from spreading. You do not cut. You do not excise or use those venom extraction kits. Don't wait for symptoms. If you're not 130% sure that it's not a venomous snake, you better go, because it can be actually a delay before you see symptoms. So, especially if you're out hiking, get there. Don't put ice on it. Don't need to do any surgery. In fact, snake bites are no longer a surgical disease, right? One of your jobs should be to help keep a surgeon out of there. I know many great surgeons. There are many of my classmates that are wonderful surgeons. But still, it doesn't mean that they need to be treating snake bites. It is a medical problem. But don't also assume that it's a dry bite. So whether you're out in West Africa, which is where this picture is, or you're walking around the U.S., know what to do. And basically, it's get to help, talk to a specialist, take off your jewelry, and don't use any of those commercialized kits. The other envenomation that I want to talk to you briefly about, because actually while I was a medical student there in Vallejo, I actually got bit by a black widow spider. These will not kill you. However, they do have a very potent toxin in their venom. And usually it's just a lot of cramping and pain, which I was in agony. But there are times where you need antivenom. And if you get to the point where you need antivenom, it actually works so quickly. I recently had a pregnant woman and a child within the same week that were bit by black widows. These guys, where rattlesnakes like to hide in crevices and kind of ambush hunt, they'll be in crevices or under rocks or under trees and things like that. So that's why you watch where you step. These guys like dark places. So when I lived in Vallejo, they were under my deck where my kayak was. So you just got to keep an eye out for them. They're not going to follow you into the house and hunt you down. But if you disturb it, then that's what it's going to do. So do know that there is a treatment available. All the ERs, they might not have the antivenom, but they have medicines that are going to work for it. So with that, thank you very much.